Hi everyone, my name is Aditi. I am a third year physiotherapy student, and this is my first video where I'm gonna explain what is ankylosing spondylitis. It is an ortho topic. So let's get started. So today's topic is ankylosing spondylitis. Ankylosis means it is a fused, bent, and spondylitis means it ankylosis is a Greek word, okay, which means a bend or a fusion. And spondylitis, it is divided into two types: itis and spondyles. Spondyles means vertebra, or spine, which we call in normal language, and itis means inflammation. Okay, so this definition goes is it is a chronic progressive inflammatory disease of the SI joint and the axial skeleton. Means what? It this is this condition which we'll come to know when it is in a chronic stage. Means as we know, there are three stages: acute, subacute, and chronic. Acute means less than a week. Subacute means a week to 14 days. And chronic means more than 3 weeks or 3 months. So, like, so this condition will come to know when it has become very severe. And it is, as we said in the name only, it is said it is an itis. Itis means what? Inflammation. It is an inflammatory disease of SI joint, that is sacroiliac joint. And the axial skeleton means the whole spinal skeleton which we have in the human body. So next is the causes. Like, this is like, we don't know the exact cause why it is happening, so that's why the cause is unknown, but it can be associated with a gene called HLA-B27 marker, which is about 85%, which tells us if the person is having ankylosing spondylitis or not. So HLA-B means a human leukocytic anti-features. Clinical features: early morning stiffness, pain in the back. On examination, patient has stiff spine. Means what? Like, when the patient wakes up in morning, he'll feel something is there in his back, which is restricting him to do any movements. So that's why it it is having morning stiffness. Obviously stiffness is there, he is unable to do any movements. Means pain will be there. And when that patient is examined by the therapist, we see stiffness present in the back. Then is the pathology, like, how exactly that happens. So in initially, inflammation of the joint means, like, the joints will have some kind of inflammation, usually in the intervertebral disc. uh, the inflammations will be present, which will cause synovitis, arthritis, and cartilage destruction. Means what? The synovial fluid which is present in the intervertebral disc between ligamentum flavum and this there is one fluid which we call. So this that will have inflammation, which and that will cause arthritis, which will lead to cartilage destruction, and this all will lead to fibrosis and later bony ankylosis. The common affected site is SI joint, which is sacroiliac joint. Sacroiliac joint, spine, hip, knees, manubrian sternum. And for us to diagnose that the patient is having ankylosing spondylitis or not, the investigations which we'll do is blood test. In that we'll see that the gene which we talked about, that is HLA-B27, ESR, CRP, ANA, and lymphocytes will all be elevated, that is it will be increased. And also we'll do x-ray which will show SI joint haziness, subchondral erosions, and sclerosis. So the next is the special test which we are gonna discuss. So there are four categories for SI joint, for cervical spine, for lumbar spine, and thoracic spine. For lumbar spines we have active SLR. The patient will be in supine position. Therapist will be standing besides the patient, and the therapist will be tell the patient to raise his one leg till 90 degrees. The test is positive if he is having pain in the back. Then it is Scober's test, or also called as modified Scober's test. In this, we'll the therapist marks 2 points on the patient's lower back, one at the level of the fifth lumbar vertebra and other 10 centimeter above it. The patient is then asked to bend forward as far as possible, and the distance between the two marks is measured again. If there is an increase of 5 centimeter or more in the distance between the two marks, it indicates there is normal lumbar flexion. But the length which we measured is less than 5 centimeter, it may indicate reduced lumbar mobility, which can be seen in conditions such as ankylosing spondylitis. Then is Gaislin's test. Gaislin's test, in this patient will be in supine position with one leg hanging off the table. The therapist will be standing beside the patient, and positive sign will come to know if the pain in the SI joint is present. When the patient is having joint in the SI joint, the test is positive. In SI joint compression, we'll take both the sacroiliac joint. We'll first palpate it properly and compress with the therapist will compress the SI joint. If he's having pain, the test is positive. Then is the Faber's test. It is also called as figure of 4 test, because the patient will be in supine position, therapist will be standing besides him, and the affected leg will be crossed over to the other leg. The positive sign is when the patient gets pain in the SI joint. So the patient will be in supine position, and his affected leg will be in figure of 4 position like this, and will compress on the knee. The patient will have pain in the SI joint, which indicates the test is positive. Then for cervical, it is tragus wall distance. In this, we'll tell the patient to stand against the wall. For example, this is the wall, and we'll tell patient to stand, and we'll measure the distance from the wall to the patient's ear. If it is more, then it indicates ankylosing spondylitis, test is positive. If it is less, Next is the flinch test. Which I don't know. Then is the finger to floor distance. In this, the patient will be standing with feet shoulder width apart. Therapist will be standing besides the patient, and the therapist will tell the patient to bend forward, reaching for their toes. The distance between the patient's fingertips and the floor is measured. Positive sign indicates increased distance or limited flexibility. In thoracic spine, here we measure chest measurements. Axilla 2 to 4, nipples 4 to 6, NCF sternum 6 to 8. Know what? And so how we manage it. So there are two types: medical management and one PT management. Medical management means what? Which orthopedics or doctors will treat. So in that we have two types. First is conservative management and second is surgical management. Conservative management, we can give medication for pain relief, corticosteroid injection. In NSAIDs we can give ibuprofen. In rheumatoid we can give methotrexate, hydrochloroquine, etc. And we'll tell the patient for lifestyle modifications. In surgery, if the conservative management is failed, then the patient has to undergo surgical treatment. So in surgical treatment there are three types which we can do: spinal fusion, joint replacement and osteotomy. Out of this, usually spinal fusion is done. This is medical management. Next, moving to surgical management, the goal is to relieve pain, maintain joint mobility and prevent deformity. For that, first we'll give stretching for chest, shoulder rolls, neck stretching, hip flexor stretch we'll give, knee to chest stretch and cat and camel stretch. After stretching, we'll provide strengthening exercises. For core stability, we'll tell patient to do planks, bridges, pelvic tilts. For upper body strengthening, we'll tell patient to do shoulder blade squeezes, arm raises, wall push-ups. For lower body, we'll tell patient to do squats, lunges and leg raises like SLR. For maintaining the posture for cervical, we'll tell patient to do chin tucks, shoulder blade squeezes again and spinal extension. we can also tell patients to do yoga, pilates, and aquatic therapy exercises. Complications which we can see in this ankylosing spondylitis is chronic pain, spinal deformity if not treated early, respiratory problems, cardiorespiratory problems, and osteoporosis. That's why we also, to relieve respiratory problems, we give breathing exercises also, like diaphragmatic breathing, then sequential breathing. That's it for this video. I hope you understood this topic. Thank you for watching. Bye.